Hi everyone, welcome back. Today's video is a really interesting one. It's a topic that we haven't covered here at all on the channel, and it's nail health. And to help us answer some questions, I have board certified dermatologist Dr. Daniel Sugai. He practices in the Seattle area, and he is so smart and so well versed in this topic. So I'm excited to have him.
Thank you so much for having me, Susan. I'm so excited to be back on the channel.
Nail health is a topic that you actually said is becoming a more and more popular topic, right?
Totally. You know, I do these quick 60-second TikTok videos on nail health, how nails are the windows into our internal health. And people can just easily look down at their nails during the TikTok and be like, oh, how do my nails look? What color are my nails? Do I have any variation in the color, the ridges, the shape? All those things can reflect how you're doing internally. I don't want to scare anyone out there, but it's just more for educational purposes. And those videos are very popular. People are sharing it with their friends and family and looking at their own health. And I've had patients in clinic coming in saying, hey, I came to you because I have gel nails and I have this mysterious rash on my face. And do you think it could be from my nails? And so I'm seeing a lot of new patients who see the TikTok, make an appointment, and they're seeing their dermatologist or even me.
Wait, can gel nails have something to do with a rash on your skin?
Yes, I'm seeing that quite a bit. And so, you know, there's a lot of acrylic and acrylate allergies out there, and it's on the rise. And so when I see people with really bad swollen, itchy, scaly rash around the eyes, around the eyelids, I go straight to their nails. I'm looking at it. Let me look at your nails. Do you have any nail products in general? Because acrylics, gel nails, they'll have those acrylate monomers that can cause a rash around your eyes. And before it even causes a rash around your fingers or around your nails, it can affect the delicate skin around the eyes first. Because as you know, we all know that's the thinnest skin on our bodies, and that will react first.
And we're probably touching our faces so much more than we think.
Exactly. That's 100% it. Because they're always like, I'm not touching my face. But like, yes, we are. We're always touching our face.
Well, so you brought up gel nails. I actually had seen lots of articles going around on social media about how the gel nails, the lamps, the lights, like they're UV lights, and that they can be causing damage to the skin. Do you know anything about that?
Yeah, I'm glad you brought that up because that's been hot news recently. The study are from reputable scientists, and the study was published, and the whole conclusion was that these gel nails that require light curing, whether LED or UV, that gel nails are involved with that kind of curing. They say if you're using a UV lamp to dry or cure the nails, that can cause cell death, DNA mutations, or damage. And every time this a piece of evidence comes out, you know, I always ask, does it apply or translate to real world settings? And whether it's, you know, sunscreen, the whole reef safe controversy or debate, you know, those studies done in a lab, is that realistic in the real world at the beach? Same here. You know, the study showed that if you have gel nails and you cure it under a UV lamp for 20 minutes twice in a day, that's acute damage to the DNA and cells around the nail. You know, when I made that post, a lot of people came out and said they were agreeing with me, like, we don't do 20-minute sessions.
Twice a day also.
Exactly right, twice a day. And then the other thing was, chronic exposure over 3 days. And they're doing 20-minute exposures. That's causing DNA death or DNA mutations as well. And so real world settings, I'm a little skeptical there. In terms of what to do though, you could always ask, are they using LED or UV lamps to cure your gel nails? And a lot of people have come out and say that a lot of salons have moved over to LED lamps. And the LED does have UV radiation in smaller doses than a dedicated UVA lamp.
That's good to know. Okay.
But not in high doses. And I'd say if you are, I guess regardless, if you don't know what they're using, just wear sunscreen on the back of your hand, says Dr. SPF. If you want to go all out, you can get those gloves, the UV protective gloves before your appointment, or bring it to your appointment. But I say sunscreen at the very least. And regardless if you're doing LED, UV lamps, you're not sure, just wear sunscreen on the back of your hands.
Wow, so many things to worry about when you're getting your gel.
Yeah, I know.
All right, so since we're sort of talking about manicures, is there anything we should know about manicures or pedicures since we're on that topic?
It's a really good question because I deal with infections around the nail or of the nail every day. especially fungal infections of the nail. And that's called onychomycosis.
What?
Onychomycosis.
Onychomycosis. So that's the fungus that you get on your nails when is it like feet and hands?
Yeah, fingernails and toenails. So I deal with that every day on a daily basis. And it's a pain in the butt to treat. It is so tough because, there's oral medications with side effects and there's topical medications that can be very expensive. How do we prevent that from happening? I'd say definitely protecting your nails and the skin around your nails when you do go to the salon to treat yourself, whether it's your fingernails. I'd say, I see bacteria infections too for people who are working on their cuticles, they're trimming their cuticles, they're getting them pushed back. Cuticles is this nice film right at the base of your nail. We call it the proximal nail fold. Is protecting that area because right under the proximal nail fold, you have your stem cells there. And the matrix is what's responsible for growing out a healthy nail plate. Now, when that stem cell network gets disrupted with either an infection, bacteria especially, can cause a really bad hot finger that we've all had. You maybe picked away a hangnail and it got infected and you get this thing called an acute paronychia. That happens quite a bit. And that can be also a pain to treat, but we have to protect this area with that cuticle and we want to respect it as much as possible. Most of the time when I see someone come in with a bad infection of their nail or around the nail, their cuticle is gone because they're chewing at it, they're picking, they're pushing it back, they're going to the salon, they're getting stuff clipped away. So I say leave it alone. Don't be afraid to tell them at the salon, hey, leave my cuticle alone. For the feet, the toenails, I see a lot of fungal infections of the feet called tinea pedis or athlete's foot. And you also get onychomycosis.
I mean, everybody that's ever participated in like a high school sport, right, has dealt with athlete's foot.
Exactly. Yeah. You're a teenager, an adult, you have sweaty feet sitting in a shoe that you've been using for months, and it just promotes fungal infections. But if you're going to the pool, public shower, wear flip-flops to protect your feet. But at the salon, when you're trying to treat yourself on that special day, how do we do it? I do think that those foot baths can be a culprit in addition to the tools. And so the foot baths, they talk about pipeless, without plumbing. I don't like the jets. I feel like things can hide in those jets, and how do you properly clean them? I don't know if the salon is properly cleaning them, but just shooting that high pressure water onto your feet, and you might have little micro tears in the skin. Maybe you shaved right before going in and you have these little micro traumatized tears in the skin, and you sit in there and your lower shins and ankles are in there and the jets are just shooting little microbes all over your feet. So those I always am like, if you're going to do it to treat yourself, maybe have the ones that are really properly sanitized. Maybe even the inserts, they have those inserts that you can pull out and change out with different clients. Those are much better. Yeah. And then in terms of tools, calling and asking them how do they sterilize and disinfect their tools. We use autoclaves in our clinic, and other salons can use autoclaves as well. And autoclaves are just using heat through pressurized steam to disinfect and sterilize the tools. And so I have patients come in and say, I think my salon gave me nail fungus. Hard to prove, but is it possible? Right. Potentially, especially if you're at the end of the day, your appointment's later on, and they've been using these tools all day, and are they really properly cleaning them? Could they be introducing, fungus around the nail into the nail matrix or of the nail itself? Those are ways to try to protect yourself.
And then just to be clear, no pushing back the cuticles as well, because I know about the no cutting, but no pushing back either.
Yeah, I'd say just leave them alone. I don't see any, benefit of pushing them back routinely. I just say leave it alone and even just protect them. So I recommend petroleum jelly or petrolatum products to just help reinforce that seal of the cuticle and keep them nice and healthy, and so they don't get ragged, frayed, too dried out. So I recommend that than just touching anything, physically going after the cuticle, because just a small little nick or tear could be a gateway or open up the floodgates for all this bacteria or fungi to go in and mess with your nail matrix.
So I think that women like me who get their nails done regularly and constantly have gel nails on, have paint on their nails, whether it's their feet or on their fingers, we sometimes get a nail stain, like that yellowish tone to our nails. How can you tell if it's a actual stain versus a fungus or some bigger issue?
Yeah, so yellow nails we see a lot, and there are different causes to yellow nails, and you just exactly hit the two common ones. Nail polish, frequent nail polish use can stain your nails yellow, and also fungal infections. But there are other more rare entities like vitamin E deficiency and thyroid disease. Low thyroid can cause you to have beta carotene keratin built up in your skin and nails, causing yellowing of your nails. But you're right, most of the time we're seeing either from nail polish or from fungal infections or onychomycosis, like we mentioned before. Now, onychomycosis or fungal infections, I'd say, looks different from the nail polish because you're going to see thickening of the nail plate where it gets pretty thick and it can lift. And when it lifts, you see a lot of this crumbly, like little, I would say pebbles, but little debris of dead skin, but also just fungus kind of collecting under the nail. And when you start seeing the thickening plus those little crumbles, sorry to use that word to describe it, but that's when I start saying, that's when I started thinking you have more of a fungal infection or something else going on that we might have to clip and definitively diagnose either through looking under the microscope and we stain it to look at the hyphae or the fungal elements under the microscope, or even send it to the lab to have it grown out and we culture it and see what kind of fungus and what is it sensitive or resistant to in terms of medications.
What happens if you don't treat it?
Nail fungus is totally fine. You can live with it. It's no danger to you. You know, we talk about, really sick patients in the hospital with fungal infections internally or in their bloodstream. This will be different. This is the same fungus that can cause like athlete's foot, and living with it is fine. I do worry about athlete's foot between the toes because those are sneaky little infections because they can eat away at your skin and cause a hole. And then you can go into bacterial infections. You can wake up with a swollen red foot. I don't see that with fungal infections of the nails. It's more of the skin I worry about. So nail fungus, you could totally just live with, and they'll just be hanging out there. You might not like the appearance of your nail, but medically...
Does it stink? Does it smell bad?
It can, yes. Fungal infections can cause an odorous smell of your feet, but it doesn't always, even if you have stinky feet, it doesn't mean you have a fungal infection either. That could be from a bacteria releasing an odor as well.
Are there things that we should know about maybe how we strengthen our nails? I think that's a huge topic that I see people talk about all the time. They're always talking about nail supplements or, like polishes that they can put on to help make their nails grow and just be stronger in general. Do you have any tips?
Yeah, I'd say eat a well-balanced diet for sure. You don't have to go crazy with the supplements, but if you do have vitamin deficiencies or if you're malnourished, your nails will be brittle and weakened. So I always say a well-balanced diet, making sure you're seeing your primary care doctor to get your labs checked, making sure you're not deficient in vitamin D, say. We're seeing that causing maybe nail brittleness as well. Biotin, we always talk about online, high dose biotin, can it help with hair loss and nails? The evidence is not concrete on that, but there are papers that show that I say it seems real. Lower doses of biotin, which is an important vitamin. I don't want to say biotin is not important. It's very important. But if you take supplemental biotin at 2,500 micrograms per day, there are studies that show it could help strengthen your nails. And I've seen patients come in saying they're on low dose biotin and their nails are better. So that's anecdotal evidence in my practice. Patients coming saying it works, and the papers do show that. So don't go crazy with the 10,000 micrograms a day. That's another example, or less is more. The higher doses can mess with your thyroid labs or even your heart enzyme labs. So I always say don't go crazy with that. Smaller doses are fine. So that's one strategy. Eating a well-balanced diet where you have, eggs and good vegetables and fruits and stuff are all good to get your vitamin intake, because even vitamin C, I talk about fruits too, because vitamin C, if you have low vitamin C, that can also cause brittle nails as well. I
constantly use collagen supplements in my smoothies and all that, and I feel like I see a difference with my hair and my nails.
That's great. Yeah, I have patients who say the same thing, and so I usually say, if it works for you, go for it. Will I go bring that up during the visit? Probably not right now until I see more studies coming out. But I do have patients who do believe that helps with their hair and nails quite a bit. I don't see any dangers right now of doing collagen supplements besides some people getting bloating, but I think it's fine if you want to do it. If you feel like it's working for your hair nail health, I'm all for it.
What do you think is the most common reason why you see people come into your practice for a nail issue? Is it something they're doing in the salon? Is it something that they're just doing in general? What do you think causes the biggest issue?
I I say probably would be external factors, but a lot of it could be internal, which we didn't talk on yet. You could have lifting of the nail or pits in your nail from, say, psoriasis. It's an inflammatory condition of the skin and even involve the joints, or even now they're saying the heart. And it can affect the nail matrix, where it affects the way your nail grows. And so if I have someone who has maybe eczema or psoriasis, I might lean more towards psoriasis if their nails are having pits or little dimples in them, and also lifting, or we say oil spots where you're getting discoloration, like white spots of your nails. Trauma can do that as well. But if you're having that on a lot of your nails and also the lifting, then I'm going to say maybe you have nail psoriasis, which could be a risk factor for you developing psoriatic arthritis down the road, where your psoriasis starts destroying the joints, the joint spaces of your hands, your back, your other joints as well. Other things that can cause pitting in your nails would be like hair loss, that alopecia areata, specifically that autoimmune condition that makes you lose your hair in patches, discrete patches where you have a whole bald patch, or even lose all of your hair. That can cause pitting of your nails as well. So internally, we can have different things. I've even found someone with blood cancer who had irregular nails and ridges in the nails. And when we biopsied the nail, it showed amyloid, which is a protein in our skin. And when you have a lot of that, it might signal that you have a blood cancer called multiple myeloma. So we've even diagnosed blood cancers from the nail itself. So the nails really are like a window into your internal health. But externally, we talked about trauma, baseball players, you know, an athlete hitting their nail all the time, causing white spots or a ridge. But also, I know there's also just regular aging. A lot of patients come in saying, why are my nails ridged vertically up and down? And that is onychorexis and a normal part of aging. And that does happen. So again, going back to diet, making sure your vitamins are all fine, especially vitamin D and such, and making sure your thyroid is okay, because low thyroid can cause brittleness and maybe ridges in your nails as well. Frequent hand washing. We're seeing a lot during COVID. People washing their hands a lot can cause nail brittleness or even horizontal ridges in splitting of their nail. So going this way, and that's called onychoschisia. So we're seeing that a lot.
How about ingrown nails? We haven't talked about that yet, because I know that it's even something that I know I've dealt with back in the past, where I felt like I didn't know who I should go see, but it felt like my toe hurt every time I put on my shoes and stuff, and it turned out it was just an ingrown nail. Yeah,
and I see that a lot, and I actually do defer that a lot of times to the podiatrist. But I always say for proper nail cutting, you always want to go straight across and not chase the corners of the nail, especially of your toes. And then we see a lot of it like your big toe, or we call the great toe, where we see that ingrown nail starts to dive down into the skin, causing a red swollen toe. It can get very infected. Try not to do it yourself, where you're trying to cut out your own ingrown toenail or trying to lift it up yourself. I say always see your podiatrist for that. They have the proper tools and techniques to help you out with that. But I'd say cutting your nails after a shower, when your nails are softer, and cutting straight across and not chasing that corner are my two biggest tips.
Well, thank you so much, Dr. Daniel Sugai. He's Dr. SPF on social media. Your TikTok has completely blown up. I feel like I get so much information. Every time I'm scrolling on TikTok, I see your videos, and they're so good. And by the way, you guys, if you want to follow him, I'm going to leave all his information in the description box.
Yeah, no, thank you so much for having me on the channel, Susan. Just giving out good skincare education backed by clinical experience and science. So I'll see you guys all there on the other channels, and thanks for having me.
You guys can also follow me on social media. I'm at Susan Yara, and we'll talk to you soon.
Bye, guys.
Bye.